Hello everybody, I am Dr. Manas Ranjan Tripathy, Senior Consultant Laparoscopic General Surgeon and Proctologist, welcoming you all again to my video awareness channel from Bangalore. Today, in continuation with our discussion about pilonidal sinus, which we have discussed last time, about what is a pilonidal sinus and in whom it is common and what difficulties it can cause. Today we will be briefly discussing about what are the common presentations of patients with pilonidal sinuses. See, if we see about the entire spectrum of the disease, most often patients have pilonidal sinus but they don't even know that they have it. It's usually during routine examination of that region we come to see a pilonidal sinus disease. These are the category of patients whom we tell as asymptomatic pilonidal sinus patients. And in patients who have symptoms, there are basically two types. One, who come with acute symptoms of inflammation, pain and pus formation. What basically happens is, because the sinus tract is usually filled with hair material, the sinus tract gets continuously irritated, the skin around the sinus tract gets inflamed, and inflamed skin, like all of us know, is very prone for infection. And once the sinus tract gets infected, the tract and the surrounding regions are filled with pus, and patient usually feels a boggy swelling which is extremely painful and lot of redness and induration around that area. So this is one of the typical features with which for the first time patient thinks that he has some problem around that area. This condition is called as pilonidal sinus complicating with an abscess. So this is the most common presentation of pilonidal sinus in patients who have symptoms. So they usually come to the outpatient departments complaining of swelling, redness and severe pain around the gluteal region, especially in the intergluteal cleft. On examination, we find that they have a pus collection which is usually connected to the midline pilonidal sinus pits. So this is the most common presentation. Many other patients have subdued presentation, like they have foul smelling discharge which is on and off, like they don't have severe pain and swelling, but continuously every 15 days to 1 month time they have some amount of blood mixed foul smelling pungent odor discharge from small pits either in the intergluteal cleft or in one of the buttocks. Depending on the severity, depending on the spread of the infection, patient may have only sinus openings in the midline, or the openings may be found on either side of the gluteal region, like either on the right side of the buttock or on the left side of the buttock, and they will be having tracts connecting the openings in the buttock to the midline sinuses. These tracts or openings are called satellite openings. Patients who have satellite openings or who have openings on either side of the buttocks, they are most likely to have complex pilonidal sinus disease. That is, not a single sinus tract but multiple tracts connected to each other. So this is a complex variety of pilonidal sinus. So what happens is, infection comes, patient has pungent discharge, smell and pain for some time, and then it gets subsided either with a course of antibiotics and anti-inflammatory or some local hygienic care, and then again to recur again after 15 to 20 days or a month based on patient to patient variation. So these are the two most common presentations of pilonidal sinus disease. Either it comes as an acute presentation with a boggy swelling or abscess which needs to be immediately attended, or intermittent chronic foul smelling pus discharge from the intergluteal cleft regions, which needs to be immediately attended in consultation with your physician, or more specifically a surgeon. So this is how a pilonidal sinus presents usually, and in our upcoming videos we will discuss about what are the treatment options we have for this disease. Thank you all. We'll be back soon with another informative video.